The cost of healthcare is rapidly escalating not only for private healthcare but for the public health sector as well. While the challenges are enormous in public funding for healthcare services, which is heavily subsidized by government, individual incomes play the determining factor in the private sector funding. According to doctors in both the public and private practices, to bridge the gap requires increased investment in priority programs to compensate for donor withdrawal, which has put immense pressure on state health resources. Health and Social Services Minister Dr. Bernard Haufiku says healthcare models in the form of National Health Fund used by developed countries may be a solution. However, this would require restructuring and robust infrastructure. Currently, Namibia uses the primary healthcare model. Dr. Haufiku says the cabinet had already approved policy on private-public partnership for the ministry.
The current situation, both in the private and public sector, is not sustainable. The Public Service Employment Medical Aid Scheme is a fund of over 1 billion Namibian dollar. But we do not have concrete, measurable, positive results coming out of it. So we need, obviously, to restructure that. I think we need to create a better management of CMAS, but this is my own opinion, you can debate it. We need a proper, efficient management structure to manage any form of national fund that we come up with. But importantly, all sectors need to buy in. Every individual must be part of the process and the whole project.
It is estimated that currently 85% of Namibia's population depend on state health services, with the rest covered by private health care. This has also posed challenges to universal coverage, especially in rural remote areas. But Dr. Haufiku is to undertake visits to clinics and health centers in Kunene and the Kavango regions next week to appraise himself of the situation on the ground.
We want basic service package from the community, where the community is having community health workers. Many of them are already trained. These are the people who educate our people about health matter. They encourage people to go to the clinic when necessary. Now, at the clinic level, we got a package as well, that there must be ABC delivered. But before we deliver that services, we have to put a structure in place. One of the basic things is just like water and electricity, if we can. It's in cabinet decision that we must spread this infrastructure to the most remote part of Namibia.
In the same vein, he also expressed dismay at xenophobic attacks in South Africa. The attacks had gone to the extent of blocking healthcare access to the victims, and Dr. Haufiku says because health systems do not operate in isolation, the acts